During moments of extreme stress or trauma, the part of our brain that encodes memory is impaired, such that when the trauma is recalled, it feels like it is happening again. That is why when we are triggered, we can suddenly feel overwhelmed. We are having what I call an emotional flashback. The good news is we can learn to step back from or unblend from these experiences, which allows us to come back into the present. We all have parts of ourselves that were wounded and never had a chance to heal. Now, I use the word part here purposefully, because even those of us with the most wounding or with really painful internal places we can fall into, even we are not defined by our wounds. They are not all of who we are. Yes, hurt places are a part of us, parts that deserve care and attention, but they are not the totality of our selfhood. We have more inside us than just our pain. This is really important and why there's always reason for hope. And that hope starts the moment we are able to separate enough from the parts of us that hold our pain to make a little space for the deeper or higher self, what in the last video I was calling the true self or adult self, to step in. That is a process that is called unblending, and it is at the core of a type of therapy called internal family systems, or IFS, which this series is about. More specifically, in this video, we will talk about how the process of unblending can help with emotional overwhelm. Now, you might be thinking, we already talked about unblending in the first 3 videos, but in the previous videos, we really only talked about unblending from what in IFS are called protector parts, which are our habitual ways of protecting ourselves, like drinking or putting up walls or overworking. When we unblend from a protector part, it gives us a bit of space to step back from our powerful impulse to relate to others or ourselves in a certain way. But in IFS, there's a whole other part of our mind that we need to step back from at times as well. Or to use IFS language, a whole other type of part to learn to unblend from. And those are our wounded parts. Unlike our protector parts, which are there to protect us from the pain, our wounded parts hold the pain itself. In IFS, they actually call these parts our exiles, because so often we try to push them out of awareness or exile them. We bury them somewhere so deep that we aren't always even aware that they are there. In fact, usually the main job of our protectors is to protect us from being aware of our wounded parts or to exile them. But why do we bury them in this way? Well, because when they do come up, and when we become blended with our wound instead of our protector, what we experience is emotional overwhelm. That is why learning to unblend from our wounded parts, whether we call them the wound or the exile, is key to learning to come out of states of overwhelm. But before we go on, let me just make sure we're on the same page. The wounded parts remember the ways we got hurt and still sort of hold that pain, while the protector parts remember the ways we learned to protect ourselves and still hold the job of protecting us in that way. So when we are blended with our protectors, when it is they that are taking over, it feels a lot like compulsiveness to act in a certain way. And when we are blended with our wound or exile, it feels a lot like pain or fear or emotional dysregulation. We already talked about the science of protectors in the last video, so let's now talk about how we might bring that science to our understanding of our wounded parts. That will really help us understand how to approach the unblending process, which will be so important for those of you who experience emotional overwhelm. So, like our protector parts, our wounded parts live in implicit memory as well, but they hold the information around what we experienced. Not just what was happening, but also how did that feel in my body? Did I feel safe or connected? Was I alone or being threatened? Did I feel a sense of worth or rather shame? Now, interestingly, most of the time when we remember our lived experience, that is considered a form of explicit memory, specifically autobiographical memory. It's explicit, which means we can consciously draw it up and remember it like remembering what we had for lunch yesterday. But here's the thing. Our memories around traumatic or overwhelming experiences are stored differently by our brain. That is because when we are in a moment of extreme stress or fear or trauma, our way of encoding memory changes. Why? Because stress hormones reduce the working of our hippocampus, and it's the hippocampus that creates explicit memory. And one of the hippocampus's most important jobs is to take what is happening, the thing we're coding into memory, and put a timestamp on it. Like when I think about graduating from high school, I can say, yeah, that happened in 1999. That seems like a while ago. I mean, it sort of seems like yesterday, but not really. I can tell the difference between the memory that actually happened yesterday and one from 22 years ago. But that is different from our experiences that are held in implicit memory, where it's almost like they're always in the present tense. This type of memory isn't so much like, oh, Dad used to shame me and it was painful. It's more like, Dad, it feels like Dad is shaming me right now. I mean, I might not have those words, but I once again will feel that sense of worthlessness and aloneness. And why is it in the present tense? Well, again, because the hippocampus fails to do its job of time-stamping very painful or traumatic memories. And this means something very important. It means that when that type of memory is triggered, it feels as if we are reliving that experience again. It is happening now. By the way, this phenomenon explains why people can have flashbacks. I mean, flashbacks are sort of an extreme version of what we were talking about, but it captures the idea. Maybe you've heard of like a war veteran returning, home and hearing a loud bang, like from a firecracker, and suddenly diving under the table, right? It's even possible for them to actually see the trauma scene or battlefield again. It's really fully reliving. But I like using that type of flashback as an example because most people know about them, for one. And flashbacks are a great example of how memory can come up in a way that the mind thinks it's happening again now because the timestamp isn't on it. It's like the past isn't in the past. So to summarize, if a hippocampus is offline when the memory forms, when we have that memory, there isn't the sensation of remembering. Usually this doesn't create as an extreme of situation as visually hallucinating that we're back somewhere else, but it's more of a somatic memory. So when our brain is reminded of a very painful emotional moment, and those same emotions I had are being triggered, it's like they're called up in my body again. These are interesting and tricky emotional moments for people because yes, the experience of emotion is happening, but really it's the emotion from the past. In other words, we are remembering an old emotion, but because it doesn't have the sensation of remembering, it just feels like we're having that emotion in the present. It feels like it's our current emotion or experience. This is very confusing and makes people feel crazy. Like, why am I overreacting in this way? What my husband said wasn't that bad, but suddenly I feel so sad and alone, or scared or angry. I mean, sometimes just to make sense of our emotions, we will tell ourselves that, well, what my husband said must be pretty bad or else I wouldn't be feeling so bad. So it can color our perception of what's going on. But usually we blame ourselves and just feel like, gosh, what's wrong with me? Why am I being so sensitive or so crazy? But there's nothing crazy about it. It's just the way the brain is wired. So what I tell my clients when they are very triggered is, don't even think of this emotion as your real emotion in a way. Think of it as your emotional memory. I'm remembering a previous emotion. It's like your body's reliving what happened before because something reminded you of the past. It's a strange thing, but it really is just as simple as having a memory. Something reminded you of the past, and now you are reliving it. I mean, we could be overwhelmed about something happening in the moment, if some horrible situation is unfolding, or if someone is being abusive to us. Well, then it's just our emotions in the moment to be scared or hurt. But if someone maybe is just, slightly challenging to us, and suddenly we feel terrified or shamed, then it's a good bet that we are going into what we might call an emotional flashback. The good news is, even just knowing about this phenomenon gives us better footing for dealing with emotional overwhelm when it comes up. Why? Because in the moment your brain is categorizing this experience as it being in the present, but with confusion maybe exactly where in the present this threat is coming from, it's like you want to help your brain out a bit. It's like, hey brain, you're having a memory. And your brain will listen to you, or at least have a better chance to begin to reorganize around how it is interpreting what is going on. And clarity does a lot in terms of helping our nervous system settle. The difficult thing about these emotional flashbacks is not only are we having to deal with the pain that came from the past, but maybe we can't understand what's going on. Like, am I really in danger? I don't think so, but I feel like I am. Am I crazy? Like, what am I missing? It's like there's no solution because we don't even know what the problem really is. I just feel bad. And that type of confusion and chaos makes the brain very anxious. So, the moment we can ever begin to step back from our reactions, see them clearly, organize them, put them into words, anything like that which brings a little order will help our brain and body to settle. That's called name it to tame it. That's really more a general teaching point about psychology versus a point about IFS specifically, although IFS works beautifully with this. But I just wanted to get the general science out around that first. And pretty much any form of trauma therapy has some tools around this piece, this helping the brain categorize the past from the present and step back from and organize the reactions, just getting a little distance from them so we can come back into the here and now. A friend of mine recently told me she even has her clients look at their hands, and notice how old they look, maybe touch their wedding band, things that remind them that they are an adult now. One of my favorite techniques is from coherence therapy called the I'm in memory exercise. I'll link to a separate video about those techniques as well. But whatever approach you use, if I can borrow IFS language, you could almost think of it as unblending from a memory. That being said, IFS doesn't talk about unblending from a memory. They talk about unblending from a part. Why? Well, because while calling it an emotional memory is descriptive, it doesn't hold that when we relive something, it's more than just, a moment in our life we're remembering, or even an emotion or experience we're remembering. We are in some ways becoming the person that lived that experience. We're not only remembering what it felt like to be neglected, we're remembering what it felt like to be neglected as a 5-year-old, maybe with the same sense of smallness perhaps, or helplessness, possibly even with the same beliefs or way that our child self interpreted what's going on, like, well, I must not be worthy of love. And when we relive all those aspects at once like that, we really almost are becoming that child again. So I think that is why in IFS they use the word part or being blended with a younger part, because if we just say we're having a memory, even an emotional memory, it perhaps doesn't capture the complexity and really tenderness of what we're talking about. Remember when we were talking about protector parts and exploring the difference between calling them, behavioral adaptations or learnings versus calling them parts, and how in using the word part, it allows us to think of them as almost like mini minds or like little people almost in and of themselves, because we are dealing with human consciousness. Well, the same is true with the parts of us that remember the pain. That neural net holds a pattern that is more than just emotion or more than just the memory of what happened in the trauma, for instance. It's rather like a pattern of a living, breathing human experiencing that trauma. The thoughts, feelings, visual input, how their brain was processing it on every level in that moment. Also, when we visualize not just the memory, but rather tune into the human inside that memory that in some ways still exists, it makes it easier to have compassion for our wounded places. Feel the difference from just thinking, oh, I'm feeling the pain that I felt as a child, and saying, oh, I'm being with my child self. I'm looking into their eyes or seeing their posture or noticing the pain on their face. When we can visualize ourselves as a child, or really whatever age we were when the trauma happened, the impulse really naturally emerges to help them and take care of them. And the truth is, most of the time we do the opposite. We stuff our wounds, we put them in the closet, never to bother us again. But that's like neglecting a child. It doesn't allow the deeper healing to happen. We don't want our wounded parts or our exiles to be exiled forever. However, we don't want to become blended with them either. Why? Because not only is it painful for us when our exiles take over and we become flooded, it's very destabilizing. Not only is it a problem for us, it's not so great for the exile either. Why? Because while the wounded places in us flood us because they're tired of being in the closet and being ignored and want us to feel and hear their pain and address their needs, right, to get our attention, the second they actually fully come online like that, at least in that kind of taking over or blending way, they're only once again alone. That's because these memories are so powerful, they really can box out or overwhelm our other adult capacities. We've talked about this in relation to our protector parts before, where when we're blended with our protectors, we have no longer access to our true self, or what IFS would call our big S self. But the same is true with our exiles. When we are blended with any part of us, it makes it impossible to access our full capacities and compassion and wisdom. And that is a problem because our exiles need our full capacities and our compassion and our wisdom, which means they need to be here with us, not in the closet where we are ignoring them. That's not healing, but also not up so close and screaming at us that we can't stay present. So we have to unblend first in order to put them in kind of like a position where actual relationship can happen. That way, they are no longer alone. But let me pull this point out just a bit, because we started this video really talking about unblending for the sake of regulation, right? But in truth, once we have unblended, we've opened the possibility for something so much deeper than simply regulation to occur. And that is actual healing. Why is healing possible from this position? Because we can connect, we can listen, we can undo this part's aloneness, which is really the aloneness of some deep level of our heart. We can address the fears and the pain and let that part know what happened wasn't his or her fault. That is our goal and intention. And if we want our exiles to unblend, it helps if they understand that goal and intention. So when you're overwhelmed, you might begin by speaking with your wounded part. You might try saying, "You're flooding my body because you want me to hear you. And yes, I want to hear you and find you. But when you flood me, I actually go away. So I'm going to ask you to step back a bit, because only if you give me a little distance can I actually show up for you." Or you might say something like, "Hey, overwhelming sadness, I see you. I need you to give me just a little space though. Not because I'm trying to push you back into the closet, because I want to be with you. I know you need me, so please let me show up for you." That's actually all our inner child part wants. So when it hears that intention from us, it will step back and give us some breathing room. So when you're overwhelmed, you can talk to your exile like that. If you're having trouble doing this alone, then you might need someone to sit with you and lend you some of their true self capacity, so some safety can come online through them first. And then that allows a bit more settling, so you can find your bearings and take the next steps. But whether alone or with someone else, just like with other unblending work, see if the part will let you locate it in your body or have an image emerge, maybe of a certain age or a certain scene, either a metaphorical scene like I see a little girl alone in some black space or in a corner, or an actual scene like I'm alone in my bedroom because my parents never paid attention to me. As the image emerges, it can shift from reliving being alone in that bedroom toward visualizing it or sensing it in some other way. It doesn't have to be visual. But the moment you have some way of tuning into it, it's like if you visualize the bedroom, you see how you're no longer in the bedroom. It's now like on the screen of your mind's eye, so you can be watching the part that's there rather than being the part. Even if you decide to enter that bedroom and connect with that part, you're still there to offer support to your part rather than becoming your part. And that is the next step that needs to unfold. It's an important next piece where you can allow yourself, when your part is ready to actually connect, to support the exile, like the girl in the bedroom, let's say. And how you know if you're ready is you ask yourself, or your therapist will ask you, how are you feeling toward that part? Remember, that's always the question to ask to make sure unblending has fully occurred. Because once you've unblended from a part and no other parts have jumped in to fill the space, the answer will be something along the lines of loving or compassionate or I just want to help. And by the way, if another voice does jump in like, I'm scared of that little girl, I just want her to stop crying, that just means another protector has stepped in and you just need to do the work around unblending from a protector first. That's all the work we talked about in the last video. And you do that because you don't want to try to heal an inner child part from another protector part, because those protector parts can't really bring healing energy, maybe managing energy, but not anything that's actually going to be healing. Healing can actually only come from our true self. And again, we know we're in true self when we check how we're feeling towards the wound, and there's just some sense of strength, compassion, empathy. And that moment, when our deepest self is finally in connection with our deepest pain, that is a powerful moment. Why? Because love and resource and connection are what heals. And that is what our adult self can give to our child self. When the young part of us can feel the adult inside begin to come into her world as a safe other, everything changes. You see, typically wounds happen when we are alone and don't have sufficient support, particularly when we are dealing with more childhood wounds. Those parts lived in a world where there was no kind, strong adult sufficient to protect them or help them understand what was going on or to offer care and compassion. But now there is. Why? Because we are that adult now. Our adult self can go toward and listen to and rescue and really heal our childhood wounds. So now that we've unblended, clearly the next step is to have a healing encounter with our wounded part. What might that healing look like or feel like? That is a question we will answer in the next video, so please stay with us. Thank you for watching. I hope you found this video helpful, and if you did, you can help me out by liking and subscribing. Or if you're a therapist who would like to train with me while earning CEUs, you can visit my website at toriolds.com.